the reasons for the epidemics and contagious diseases that prevailed in Auschwitz and other concentration camps included the dreadful living conditions, the Nazi regime's persecution of Jews, political opponents, and other groups created overcrowded, unhygienic conditions in camps and ghettos that established the perfect conditions for epidemics of contagious diseases to flourish. The harsh living condition, characterized by crowding, absent sanitation and poor personal hygiene led to considerable morbidity, mainly due to injuries, infectious diseases and famine, and to high mortality rates. Wooden barracks, especially the stable-type ones, provided hardly any protection against weather conditions. In the winter, 2 small heaters would be placed in each barracks, but they were highly insufficient to effectively heat such large and drafty spaces. This is History Rediscovered. To support, please subscribe. In this video, we discuss the dreadful hygiene conditions in the Nazi concentration camps. Barracks had no sewage systems. Some parts of human physiology, such as urination, defecation, flatulence, as well as toilets and sanitation, human excrements and their disposal, and the sewage system are rarely discussed on the civilized society. Except of course during training programs for nurses and doctors or caregiving to the elderly. If I may briefly explain, this is perhaps the reason why the awkward and complex but crucial problem of excrements and its disposal in the concentration camps that were in operation between 1939 and 1945 has not yet been addressed individually, but we will do that in this video. When people ask about the camps, they frequently assume that verbal abuse, physical abuse and malnutrition were the main sources of tyranny. Nonetheless, life in the jails provided a number of difficulties that may seem trivial, but proved to be a significant annoyance, especially when they were overcrowded. The Germans seized the chance to use all those traits of the human race against their detainees. It is all the more astonishing considering that they have always taken great pride in being a highly civilized nation, including in terms of sanitation. It should be emphasized that they frequently referred to Poles as filthy, using the phrase, "Smashtik Polak," even though the dirt was caused by bad conditions in the camps. The barracks had no sewage system. Until the spring of 1943, they lacked even the most basic sanitation. The lack of water made it impossible for the prisoners to wash themselves or to clean their clothes or underwear. The inmates were not allowed to keep any cleaning items. Due to the lack of sanitary installations, during the day completely unshielded sewage pits had to be used as field latrines. Since leaving the barracks was forbidden during the nights, a set of large, wooden containers served as communal toilets until each morning. These tended to be permanently overfilled, and the stench they generated was appalling, particularly given the fact that all windows had to remain closed even in the greatest heats of the summer. The mates were constantly plagued by insects such as fleas and lice that would spread the infectious diseases among those detained in the camp, particularly the exceptionally lethal typhoid. For instance, in the women's section of the Pawiak jail in Warsaw, which was called Serbia, the cells were about 5 by 6 meters and had just one small window. Each cell was occupied by up to 42 women, who were allowed to use the corner, that is a toilet in the nook of the corridor, only twice a day, in the morning and in the evening, for 15 minutes. The toilet had just 5 seats, so long queues formed in front of each of them. The women waiting in line rushed the occupier of the seat. They all wanted to use the toilet within the prescribed quarter hour. Not allowed to defecate for long periods, the women were usually constipated, and often unable to urinate when told to do so. They were in such a hurry that many did not manage to evacuate the bladder and bowels in the normal way. Unsanitary selection on prisoners. The new arrivals that survived the selection that took place on Die Ramp were sent directly to a section known as the sauna, where they were disinfected, shaved, stripped of their clothes and their valuables, and tattooed with a number, which since then would replace its name before the camp authorities. After this, the SS herded them to the quarantine zone, where they came in contact at once with the camp operation. including arbitrary punishments, absence of privacy and lack of health care. During their stay in Auschwitz, prisoners received only one ragged uniform and a pair of shoes or crude, uncomfortable clogs that caused serious sores to most of them and made them sick. They wore the same attire to work during the day and to sleep at night, and it was often lice-ridden. This, added to the overcrowding of the camp and the hunger, caused contagious diseases as dysentery to easily propagate among prisoners, who were in no position to fight them. To make matters worse, inmates lived in fully unhealthy barracks scarcely ventilated and barely insulated from the extreme cold that was common in Oswiecim, where winters are particularly harsh. These primitive buildings did not even have a bathroom, but one bucket for the hundreds of inhabitants of each block. Prisoners slept on dirty floors. Even in early 1943, the prisoners were quartered in unfinished barracks which lacked window panes or even the most basic furniture. Before bunk beds were installed and bed ticks were distributed, the inmates were forced to sleep directly on the floor or the ground. Barracks intended to house 150 to 250 people according to the camp construction plans, would usually house a far greater number of prisoners. In the period of the greatest overcrowdedness, that number could sometimes reach even beyond 1,000 inmates kept in a single barracks. Later in Auschwitz I, prisoners lived in old brick barracks. Several hundred three-tier wooden bunk beds were installed in each building. The overcrowding in Auschwitz I forced basements and lofts into use as living quarters, as well. Two types of barracks, brick and wooden, housed prisoners in Birkenau concentration camp. The brick buildings were erected in great haste, without suitable insulation, on marshy ground. More than 700 people were assigned to each barrack, although in practice the figure was sometimes higher. These barracks lacked any true heating, nor did they contain sanitary facilities. The second type of accommodation for prisoners at Birkenau consisted of wooden stable barracks, Verdestelbaracken. The interiors, designed to hold 52 horses, were partitioned into stalls. The stalls contained three-tier wooden bunks. Several hundred prisoners lived in each such barrack. Dampness, leaky roofs, and the fouling of straw and straw mattresses by prisoners suffering from diarrhea made difficult living conditions worse. The barracks swarmed with various sorts of vermin and rats. A constant shortage of water for washing, and the lack of suitable sanitary. Prisoners bought food with cigarettes. One survivor described the cigarette currency used in the camp: "We had our own currency, whose value no one questioned, the cigarette." The price of every article was stated in cigarettes, in normal times, that is, when the candidates to the gas chambers were coming in at a regular pace. A loaf of bread cost 12 cigarettes, a 10-ounce package of margarine, 30, a watch, 80 to 200, a 0.25-gallon bottle of alcohol, 400 cigarettes. Feeding the prisoners. Prisoners in the camp received meals 3 times a day, morning, noon, and evening. Factors influencing the nutritional value of the food included the official nutritional norms in the Nazi concentration camps. In practice, Auschwitz prisoners with less physically demanding labor assignments received approximately 1,300 calories per day, while those engaged in hard labor received approximately 1,700. After several weeks on such starvation rations in the camp, most prisoners began to experience organic deterioration that led to the so-called Muselmann state, extreme physical exhaustion that ended in death. Prisoners spent over 10 hours per day working, and the rest of the time was taken up by long roll call assemblies, lining up for food rations or a place in the latrines or the washroom, removing dirt and pests from clothing, and disinfection. Camps were assigned physicians. Each camp had a chief SS physician accompanied by a number of assistants and orderlies. There was also a parallel system of prisoner physicians. There was a chief prisoner physician in every camp, and each block was assigned a block doctor who was responsible for sanitation, the removal of corpses, setting up the sick call and authorizing sick leave. Work teams were accompanied by mobile doctors, Streckenpfleger, who dispensed first aid for work injuries. Prisoner physicians were also charged with disinfecting the blocks and maintaining hygienic conditions in the camp. Every camp had one or more blocks, called reviers, that were used for treatment and hospitalization. In the larger camps, a number of blocks were designated to function as a sort of hospital, Krankenbau. At times, one camp out of a group of camps would be set aside as quarantine, primarily for patients with infectious diseases. Officially, the revier was the responsibility of an SS physicians, assisted by a chief prisoner physician, his assistants and, at times, nurses. But in actuality the reviers were managed by prisoners, capos, who did not have medical training but were authorized to make decisions in medical matters such as operations and, on occasion, even performed them. The reviers suffered from shortage of everything: beds, manpower, diagnostic and therapeutic means, sterile supplies, and drugs for anesthesia. Crowding was the rule, and each cot was occupied simultaneously by several patients regardless of their condition or the nature of their disease. Life-saving procedures could not be performed, and surgery, if done, was usually without anesthesia. Mortality was high, and the revier was commonly perceived by the prisoners as a place of death, not of healing. Occasionally there were visits, or inspections, by the SS physicians.